are going to start by introducing our Sergeant at Arms and thank them for their service to us. Terry Barnhart, Robert Cordell, Cherie Hedrick, Linda Matthews, and Hal Roach. Thank you, ladies and gentlemen, for being here. And we do have some Senate pages with us today. We're so glad to see you all. We have Jahara Anderson from Durham, North Carolina, sponsored by Senator Murdoch. Alyssa Bissonette from Harrisburg, North Carolina, sponsored by Senator Paul Newton. Sam Ostro from Blowing Rock, sponsored by Senator Heiss. John Scott from Cary, North Carolina, sponsored by Senator Adcock. Bryce Stathopoulos. Did I get that right, Bryce? Thank you. From Wilmington, North Carolina, sponsored by Senator Rabun. Anya Trivedi from Raleigh, North Carolina, sponsored by Senator Grafstein. Thank you, pages, for being here. Hope you have an enjoyable week and that you learn a lot. And please come back soon. Thank you for being here and serving us. We are going to change our agenda around just a little bit this morning without any objections from the committee. Representative Potts has to go work on the House side, so we're going to let him come forward and explain House Bill 190. Welcome.
Thank you, Madam Chair. I believe there's an amendment. If you would like to run it first, it would be fine with me.
Okay, and you want staff to, who has the amendment? Corbin? You're recognized to explain the amendment.
Thank you, Madam Chairman. I move to amend the bill on page 16, lines 34 through 37. I'm going to ask staff to explain that, please.
Good morning, Teresa Matula from Legislative Analysis. So this bill adds four new parts to House 190. The first one allows opioid treatment program medication units and mobile units. So this was requested by the department, and my understanding is that it would allow opioid treatment more accessible in neighborhoods so that the mobile treatment unit could go to the patient rather than the patient having to come to a facility every single day. The second is to add gabapentin to the controlled substance reporting system. My understanding from the department is this is requested because there are interactions between opioids and gabapentin. The next section is on page 7, and it's on page 6, and it requires electronic prescribing for codeine cough syrup. My understanding from the department is there's been an increase in forgery, so this would require an electronic prescription. And the final one is on page 7, and it pertains to over-the-counter opioid antagonist treatment, to just add over-the-counter treatments to our current statutes.
Thank you, Ms. Matula. Any questions on the amendment? Seeing none, all those in favor of the amendment, please say aye. Aye. Any opposed? The amendment passes. Now, Representative Potts, you're recognized to explain the bill.
Thank you, Madam Chair. House 190, with this amendment, has gone through 6 environmental changes to get to where we are today. It equalizes special assistance regardless of the residence, whether you're at home or in a facility. Authorizes triennial adult home licensing. It changes substance abuse to substance use, lengthens the duration of the county's first temporary work first plans to 3 years. They're a difficult process to go through. Renames the Division of Vocal Rehabilitation Service to Division of Employment and Independence for people with disabilities. And finally, one of the many other things it does is amend the education experience for environmental health scientists. We're all experiencing a short of basically septic tank inspectors in our county, and they're backed up, and this will hopefully alleviate some of their problems. And I thank you for the opportunity to be here.
Thank you, Representative Potts. Questions from the committee members? We have no questions. We are have an amendment for a favorable report on the committee. All those in favor, please say aye. Aye. Any opposed? Thank you, Representative Potts.
Thank you.
Get to your session on time.
You need to read the motion.
The motion, let me,
Right over here. We need to do this.
this is the exact wording of the motion. For a favorable report for the bill as amended, rolled into a new PCS, unfavorable to the original, with a referral to rules. That's your motion, Senator Corbin?
That is what I said, Madam Chairman.
Thank you. Thank you, Representative Potts. Now we're going to go back to the top of our agenda for House Bill 125, and this bill was for discussion only last week, and it's still before the committee, and Senator Sari is recognized to explain the PCS, and I believe he also has some amendments. So, Senator Sari, you're recognized.
Thank you, Madam Chair. This is the PCS for House Bill 125, and I do have 2 amendments to it if we'd like to take those up first.
Which one would you like to do first?
Let's do the easy one is the short one first. This is H125 ASH 19 version 3.
You're recognized to explain the amendment.
Thank you, Madam Chair. This adds on to page 2, lines 46 through 48, and rewrites the lines. What it does is there's already a provision here with regard to international physicians. What this will do is expand the scope of it to allow an international physician to actually come and practice in a rural community, provided they're doing so under the supervision of a North Carolina licensed doctor. This is something that we're hoping to do to address some of the healthcare deserts in eastern, central, and western North Carolina, and I'd commend it for your passage.
Any questions for the bill sponsor on the amendment? Seeing none, we have a motion to approve the amendment from Senator Bergen. All those in favor, please say aye. Aye. Any opposed? The amendment is passed. Senator Sari, you're recognized.
Thank you, Madam Chair. Another amendment, this is 125 ASH 20 version 5.
You're recognized to explain the amendment.
Thank you, Madam Chair. This is an amendment. It does several things. And first, I do want to take a minute to thank staff, thank some of the folks that I met with over the past week to go over some of their concerns after the discussion. It was a really productive conversation that we had, and this amendment is really a compilation of a lot of those conversations. One of the things I'll go through if there are any specific questions, glad to answer, but it expands the definition of a law enforcement officer based on my conversation with the hospitals to understand kind of how their law enforcement on site works. You'll see an amendment there. We did change some of the reporting requirements with regard to security plan after some conversations or listening to some feedback from DHHS that requires it to be reported to some local county municipal police forces as well as local emergency management directors. There is also a deletion of some of the harsher penalties. There was the B1 felony issue that was raised. That section was deleted. The section was conformed to be with the penalties that we have for crimes or assaults upon law enforcement officers and other first responders as well. And there is a provision that limits the reporting period by AOC for a period of 5 years rather than indefinitely. There's another amendment that I want to point out to you that's on the final page. This is a specific provision with EMTALA, that's related to EMTALA, which is a federal law that would not bar somebody that's subject to a protective order from seeking emergency medical treatment. That was a concern that was raised as well by the hospitals and some people in legal when we were consulting and discussing this. Again, glad to answer any questions, but would ask for its passage.
Thank you, Senator Sari. Questions from the committee members on the amendment? Seeing none, we have a motion for a favorable from Senator Corbin. All those in favor, please say aye. Aye. Any opposed? The bill is back before you. Senator Sari.
Thank you, Madam Chair. The bill is substantially the same form as it was last week as amended. My other comment that I would make is that I think this is the beginning of a process. When I'm talking to my hospitals and local people that work in the hospitals, there are concerns with IVC, mental health, behavioral health issues that aren't necessarily being addressed here, and that's a bigger issue. It's going to be a bigger lift over the next year or two. It's something that I think we need to work through as a body and as a state. And I would also invite or intend to have a conversation with our district attorneys and some of our judges as well about how we can collaborate and make sure that we're holding some of these people accountable and properly getting the resources in the places that we need so they can enforce these laws and hopefully do so in a manner that makes it a safe environment for our doctors and our nurses and our other hospital employees to work, as well as getting the care and treatment of the people that need it. Madam Chair, I appreciate the opportunity to work on this and would commend it for passage.
Any questions from the committee? Senator Mohammed, you're recognized.
Thank you, Madam Chair. Just want to thank Senator Sari for the amendments. Appreciate that.
Any further questions? Senator Mayfield.
My understanding, thank you, Madam Chair. My understanding is that the audiologists have some concern with something in this bill. Is that right, or is that in another bill?
Senator Sari.
They do. So yesterday at 5 o'clock, I received an email to all the health committee health members on this committee, and we looked at it. We had a conversation. I had a conversation with some of the hearing aid specialists as well, reviewed some of the prior correspondence. It's been going back to March at this point, reviewed some of the correspondence from some of the trade groups. There's a discussion about a potential amendment to remove this section. I'll say in committee, I've said in emails to the audiologists as well, I'll work with you. I'm committed to doing so to make sure that's something that, we get right, but don't necessarily their concerns. I'm sure we'll hear from them here in a second, but I think the health chairs and Senator Adcock and I have had some conversations about that.
Okay. All right. Thank you.
Any further questions or comments from the committee? Any members of the audience wish to speak? Seeing none, we have a motion from Senator Bergen. I will read Senator Bergen's motion if that's agreeable. Motion for a favorable report for the PCS as amended, rolled into a new PCS, unfavorable to the original, with leave for staff to make technical and conforming changes when engrossing the amendments, and a referral to rules. All those in favor, please say aye. Aye. Any opposed? The bill passes. Thank you, Senator Sari.
I believe there needs to be a referral to judiciary as well.
Serial referral to judiciary and rules.
Thank you.
Thank you. That's not on my list, but we will certainly take care of that. Thank you. And I'm going to ask my colleague, Senator Bergen, to please take the podium.
Thank you, Madam Chair. And we're going to be hearing House Bill 344. This is a PCS, so there will not be any votes, and I need a motion to put the PCS before the committee for discussion only. Senator Jarvis makes the motion. Any discussion? All in favor say aye. Aye. Madam Chairman, you're recognized to present the bill.
Thank you, Mr. Chairman. Members, this bill underwent extensive changes through a lot of ongoing discussions, and Karen McLeod from Benchmarks is here as well. She'll be able to answer any in-depth questions that any of you may have. But it does not achieve the goal of the original bill. It's intended to accomplish DHSR revisions to make to establish. They have agreed that we will continue to work on it by establishing a work group to work diligently with providers to address ongoing concerns. My biggest concern is that we have a lot of children within our foster care system, within our care, that are being sent to other states that have severe behavioral problems. We're sending them to states all over the country. Particularly South Carolina gets a lot of our kids. So we started looking and saying, are our regulations too stringent? Because we don't have enough beds for them here. Why is that? If South Carolina can house their kids and our kids, why can't we house our kids here? If they're not doing it right, then why are we sending our kids there? So we've started digging in to try to improve the system somewhat. But DHSR has been holding discussions with Benchmarks for quite some time now. They've been working together. did not get to where we wanted to be, but we have a commitment from everybody. Section 1 requires that DHSR develop a dashboard of their actions for the providers. This is all in Section 1. The data collected for this dashboard is important so that we maintain transparency and identify changes in trends. The changes could indicate issues such as training needs for the DHSR staff or training needed for the providers themselves. Section 1 requires DHSR to post on their website important information that has significant financial implications for the providers. That includes DHSR's response times and legal pathway that have been taken on the cases that they're serving. Section 2 requires DHSR to establish a work group with providers to address all of the ongoing concerns that we talked about. These discussions are intended to promote better communication between the providers. It requires DHSR to provide annual training to providers, and it will actively seek ongoing feedback from providers and their associations on the topics of those trainings and how those trainings are progressing. It requires DHSR to review how it requests and receive data to align with the electronic health records that most agencies now need to utilize. This is to reduce duplication and also to recognize the integrity protections that are inherent in those electronic health records. An example is you can't add or change signatures or dates of service that can verify an agency's compliance. And I don't think I told you DHSR is the Department of Health Service Regulation. We have lots of acronyms around here, but that's what that stands for, and they regulate the homes that